The Implant Concierge Bone Reduction Guide package delivers predictable and efficient results. Let's examine the step-by-step process to ensure a successful outcome. Before initiating any extractions, reflect the soft tissue from the buccal alveolar bone, extending apically to guarantee proper seating of the bone reduction guide. Position the bone reduction guide directly to the buccal bone anatomy. Next, seat the delivery guide over the dentition and utilize the anatomical verification windows to ensure that the delivery guide is fully seated. Then, connect the bone reduction guide with the delivery guide. Verify that the bone reduction guide intimately fits to the buccal bone with no tissue impingement and check the indicator lines. Secure the guides with the blue pins. Keep constant apical pressure on the guides while drilling the anchor pin osteotomies sequentially. Starting with the anchor pin closest to the midline, insert each anchor pin until reaching the desired depth and repeat the process, alternating sides for optimal precision. Now, moving on to extractions and alveoloplasty. Carefully detach the delivery guide from the bone reduction guide by removing the blue pins. Follow the surgical protocol for tooth extraction. Ensure the bone reduction guide is not used as a leverage bar. Reduce the alveolar crest level with the contour of the bone reduction guide, minimizing contact with the guide itself. Attach the multi-purpose guide to the bone reduction guide, confirming indicator line alignment. If not aligned, it may be necessary to perform additional alveoloplasty. Secure the guides together using the blue pins. When proper fit is achieved, remove the blue pins and the multi-purpose guide. It is now time to create osteotomies and place the implants. Attach the implant surgical guide to the bone reduction guide, securing them with the blue pins and ensuring indicator lines are aligned. Review the surgical protocol notes carefully. Follow the surgical protocol and implant manufacturer's guidelines for precise osteotomies. Fully guided cases allow implant placement through the guide. Align timing marks on the implant mount to the surgical guide sleeve to ensure proper rotation alignment. After placing the implants, remove the blue pins and the implant surgical guide. If the implant is placed subcrestally, carefully remove the bone around the implant shoulder to allow the abutment to seat fully. If you added a guided prosthetic for immediate delivery, follow these steps to deliver the passive fit bridge. Attach the multi-purpose guide to the bone reduction guide, securing with the blue pins and verifying indicator lines alignment. Follow the provisional component list to deliver the multi-unit abutments. For angled implants, align the abutment hex driver to the indicator line on the multi-purpose guide for angle correction. Tighten according to the manufacturer's torque recommendations. Take a radiograph to confirm the proper seat of the multi-unit abutments. Place 2 temporary cylinders bilaterally, hand tightening each. Ensure a passive draw of the passive fit bridge by trying it in and adjusting it as needed. Repeat these steps for each temporary cylinder. Position rubber dam gaskets over each cylinder, avoiding interference with the multi-purpose guide indexes. Position the passive fit bridge over the indexes of the multi-purpose guide and mark temporary cylinders to match the contour of the passive fit bridge. Remove and trim the temporary cylinders before delivering them. Refit the cylinders and the passive fit bridge. Use the material of choice to block out the screw access channel opening. Have the patient occlude into the bite verification appliance, ensuring the midline is in the correct position. If misaligned, remove the multi-purpose guide indexes to adjust the midline. While in occlusion, inject the material through the buccal holes to lute to the temporary cylinders. Repeat for each temporary cylinder. Following the material manufacturer's curing recommendations. Inject the material through the occlusal surface. Follow the material manufacturer's curing recommendations. Remove prosthetic screws and the passive fit bridge, ensuring the temporary cylinders are securely attached. Remove the blue pins and the multi-purpose guide. Gently seat healing caps over the multi-unit abutments with hand pressure. Remove the anchor pins and then the bone reduction guide. Evaluate the surgical site and smooth any sharp edges if needed. Apply bone graft if necessary and suture the tissue around the healing caps.
Inspect the passive fit bridge for voids on the intaglio, buccal, and cameo surfaces.
If present, fill it with luting material of choice and cure. Remove bulk material with a carbide burr. Use a coarse rubber point for smoothing. Achieve your desired finish using a fine rubber point or a wheel to polish all surfaces. Remove the healing caps and seat the passive fit bridge onto the multi-unit abutments, ensuring no tissue is trapped. Initially, hand tighten each prosthetic screw in a star pattern, and then tighten it according to the manufacturer's torque recommendation. Check to ensure no acrylic is interfering with the desired occlusion. Adjust the occlusion to achieve bilateral contacts. Fill in the screw access holes with cotton and material of choice. It is common for the bite to be slightly open immediately after surgery. Final occlusal adjustments should be made 24 to 36 hours after the procedure. Congratulations! You have successfully completed the Implant Concierge Bone Reduction Guide procedure, bringing precision and excellence to your dental practice. For additional information, please visit our website.